welcome everybody. This is our 6th or 7th lab now since we've gotten started. I'm Mike Warren. I'm the president of Alternative Health Concepts. And to my, I always get confused, I think it's this way.
You're right.
Is my dad, Dr. Warren. He's my partner, and we have this company called Alternative Health Concepts. I'll get real fancy on you and see if you can see my our website. You can go there and see what we're all about. Below me on my screen is Wayne Dorban. Wayne is a partner of ours. He runs our marketing and does our internet marketing for us, and just been a great asset. The kind of unique thing about Wayne is he's an animal lover also. Big into dogs, and he's got an alpaca farm, so I'm sure he'll have some insight in today's subject, which, by the way, we're getting ready, as many of you know that have been to our website and follow us. We have a human immune modulating product called BioPro Plus, and you can get it on the website, and it helps modulate your immune system. We also put out great content on how to heal yourself naturally, and that's what our company's all about, in conjunction with this product that we sell. And we're getting ready within the next few weeks, and that's kind of what our special announcement is today, to announce that we are going to open an animal line of BioPro, which is going to be called BioEqualizer. And we're going to initially start with, because my dad's a veterinarian, we're going to be starting with a horse website dedicated specifically to the alternative health methods available to horse owners of all kinds, whether they be in racing, whether they be in hunter jumpers, or even backyard horses, rodeo horses, anything horses related we're going to have on our website. We're going to have a lot of great content. We're going to have our weekly blogs going out. We're going to do blabs on horses. So we're really excited to be launching that in the next couple of weeks here. So with that, I want to introduce you to our guest today. Happens to be the CEO of Alternative Health Concepts. That's my father, Dr. Warren. He's a practicing equine veterinarian at the local thoroughbred racetracks in Southern California. He's been doing this for almost as long as I am old. Almost 50 years or thereabouts, 50 years he's been practicing at the local racetracks, and just had some wonderful experiences there in helping horses get better. So without further ado, I'm going to turn it over to you, Dr. Warren, and let you introduce our special guest, and happens to be a person that works with us, but I'll let you introduce Pam.
Great. Thank you, Michael. Well, it's great to be here this morning, and we do have a special guest, my #1 respiratory technician, Pam Gomez. She's a horsewoman extraordinaire. She's she does things with horses that I couldn't think were possible.
She's a horse whisperer.
Yeah, basically. She gets into their heads and can understand how to get around some of their problems. She's also a bull rider extraordinaire and a calf roper extraordinaire. She's participated in both those competitions, and she has a little farm called Reston Farms in Norco, California, where she does rehabilitation and breaks horses, and has some input in Karma, the retirement farm concept to take some of our old battered warriors from the racetrack and rehabilitate them into useful animals, and she's got a passion for that. She also is an instructor for young people, and teach them how to ride and handle themselves around horses. So without further ado, welcome, Pam. We appreciate you showing up this morning and taking time out of your busy day to help us with this project.
Well, good morning, all.
Good morning.
What I wanted to do this morning, before we get into the case that Pam had one of the main cases Pam wanted to talk about this morning, I wanted to give a brief explanation of bioequalizer and what it is scientifically, so people that are not familiar with our product have a little idea what it is. It is a immune modulator. It's a series of thymus proteins, which I've been working on perfecting with manufacturers since 1995 in the human field, and we've been using it in horses for probably 7 or 8 years as an oral product. It has 1 or 2 specific uses. It stimulates the CD4 cell, which is a special type of lymphocyte, to be able to identify and any invaders in our body, whether they be bacteria, virus, fungus, protozoa, any foreign invader, they identify, the cells then produce certain what we call cytokines. It's interferons and interleukins, which then sensitize and tell the CD8 or killer cell what this critter looks like and how to go about finding it and destroying it in the body. That's a basic, real basic scientific session on what we're doing. And I have long had the opinion that bleeders in the racetrack have been a bane for years and years. Back in '65, when I first started on the quest to overcome some of these bleeder problems, horses bleed from extra. Well, EIPH is what we call it. It's exercise-induced pulmonary hemorrhage. They bleed from the lungs just due to the excess blood pressure in the lungs. More than that, I have long thought that because of the stress of our animals in these stalls 23 out of 24 hours, with all the molds and ammonia from the urine and just being cooped up in those stalls with lack of air, they suffer from low-grade infections, which the body can take care of, keep them in a closet, so to speak. But when they're stressed from the race, and a race is a stress on an animal, they break down and cause these other untoward effects. So when I first learned about this product, I thought, well, that might be a real good help to keep these horses from bleeding. So as time goes on, a trainer friend of mine, Howard Zucker, we started with a horse he had that he couldn't stop from bleeding, and we were giving it 10 packets of the human product a day, and lo and behold, he went from a 22,000 claiming horse. He won a overnight stake and became a stake horse, and he sold him. But so I said, well, this may have some promise. So we developed this product, bioequalizer, in a different form. It's a 2-vial form with a powder and a nano silver solution where it was easier to administer. We then could administer with a syringe, or we could flush it up there with a pipette up into their pharynx and use it to help with any nasopharyngeal, what we call hyperplasia, which we see in all 2-year-olds. And it was working very well, and it helped the bleeding process. Then about three years ago, a nebulizer called Flexineb came out on the market, and I was very interested in it because it is a ultrasonic nebulizer. It breaks down the particle in the right particle size, about 2 microns, so the lungs can absorb them properly. And we started using the Flexineb, nebulizer with the Flexineb, and we got tremendous results. In fact, I did a statistical study this year from it's about an 8-month study where we have been able to show that the horses that we've treated regularly, and we treat them 3 days a week, we treat them regularly, 49% of those horses have won, and one place or show in the money, and roughly 77% have gone from a win to 5. They've been in the upper half of the fields. They paid purses down to the 5th place. So we've had some great success that way, and we still have some failures, of course. About 25% still are having some struggles with bleeding or other problems, and we're not going to overcome everything, and I realize that, but I think we've done a pretty adequate job in keeping the bleeding under control and making these horses healthier so they perform better. So basically, that's where we're at. We have a lot of, there are other immune stimulants on the market, X-Stim and some other immune stimulants, injections. They're Bactrins basically that stimulate the humoral side of the system. They do not stimulate the cell-mediated side, is where we're at. We stimulate the cell-mediated side of immunity, and it's the only product on the market that will do that at the present time.
Dad,
so
just
yes,
real quick, I just wanted everybody to know that I didn't turn into a horse. But that's a picture of the Flexinev nebulizer that you were talking about that we use with our racehorses. So everybody can kind of get an idea of what that is. It's a self-contained unit. It's really an amazing product that was developed in Ireland, where happens to be our manager lives. That is our team manager, our project manager here at Alternative Health Concepts. She actually lives in Ireland, and she's doing the moderating off to the right, by the way, in the chat room for you guys today. So she's answering your questions. But I wanted everybody to see that because it's kind of hard to visualize what kind of a nebulizer might work. And we pour the little top cap that you see that with the little blue cap on the very top of it, of the unit, is where we pour the bioequalizer in that, and then we nebulize it. So I just wanted to give everybody an idea. I'll be quiet and get.
That's great. Well, they've also developed a nebulizer for foals. We have a special. This is a very good fitting nebulizer. You have very little escape from. So they breathe in essentially everything that comes through that chamber. They have a full-size nebulizer as well. And they've also developed nebulizers for dogs and a nebulizer box for cats, which we're very interested in.
Dr. Warren or Pam?
Yes.
A quick question.
Sure.
How do horses that have never had a nebulizer on before, and I'm assuming racehorses are used to having things go over their muzzle, but I know dogs aren't, and I know alpacas aren't. So just curious how they react, and maybe Pam, you're the horse whisperer. How do you calm them and such as that gets put on?
Well, I'll let Pam answer that question. Pam, when you get a spooky horse, how do they react to you?
Well, usually what I will do is I make it a pleasant experience for them, and I'll usually put a little snack in the bottom, get them interested into what is in the bottom of the nebulizer, and they quickly relate it to a good, fun experience.
Pam taught me that trick. She cuts up some carrots. She cuts up some carrots and puts it in there, and it's much like a feed bag. Sometimes we put feed bags on these horses. We feed them some oats and so forth. And I've got to take a picture of Pam. I've met Pam in the barn when she's been nebulizing horses, and I've seen her do it without even a halter on. Just have the horse standing out over the webbing, and she just nebulizes them. When she comes walking down the shed row, they're all screaming for her to come over and nebulize them because they know what they're in for. But the first time, Wayne, to answer your question, the first time you go slow. You have to make sure that they don't get spooked, and like Pam said, they make a pleasurable experience. And listen, they're pretty easy to get along with as long as you don't try to cowboy them all the time. Is that right, Pam?
Sure.
Yeah. As long as the first couple experiences are good, you're good. But you don't want to strap anything and secure it down where they feel like they're being attacked and and just make it just spend a little time early on, and then you'll make up that time leaps and bounds by having a horse that's willing and happy to be nebulized.
So, by the way, we just had a guest come on here, Kim Wendy. Kim, wow, looks like you've done a bunch with horse agility, horse training, holistic animal nutrition. Awesome. I use that as just a little bit of an interruption here. Got a lot of new people coming on. Everybody would. Yeah, Blob is a rather new platform that lots of us are using to get the word out to people in our tribes. And a couple of things: make sure to put your questions over on the screen, and there's been a couple up here right now that we'll ask in just a minute, and we'll certainly get to all of those. But also follow each other. You see all of the pictures up on the top of your screen. If you follow each other, and then any of you are going to be having your own blobs or different things that you're going to want to be talking about, that way those folks will know about it, and so on. So just kind of keep doing that. And now, Dr. Warren, we'll go back to you.
Thanks, Wayne. I wanted to get back to the problem with horses. We've only had one horse way back. One of the first horses I treated. It was a stakes class filly, but she was bleeding. She'd been bleeding so hard for so long that she hated the world. They had to take her to the track with the pony, and she hated to go to the track because she knew it was going to hurt. When the blacksmith worked on her, she had to have tranquilizers because she didn't want him even to fool with her. She just wanted to be left alone. The first 3 times we treated her, I had to use Rompum on her, which is a tranquilizer, in order for her to otherwise she'd flip out. She tried to flip over the first time we put it on her. Well, after the 3rd time, and then just 3 treatments, we got a pretty good response with her from that time forth. We didn't have to use the trank anymore. She come right to the front of the stall, and she was very receptive to it. I talked to the blacksmith about 2 weeks later. I said, "How are you getting along with that filly that and I forget her name now. I treat so many of them, but anyhow, how do you get along with that filly?" And he said, "Well, I don't even have to trank her anymore. And she went the track by herself. She got as sweet as a piece of candy because she wasn't hurting anymore. We controlled the bleeding." She went on to win 3 or 4 stakes and several $100,000. But that's the only one I've ever had to tranquilize, and it can be done if you have a real problem horse. Sometimes horses that are really high strung, and Pam will attest to this, even when you're nebulizing them, if something goes on, a truck goes by, or they get spooked, they will rear up and they'll back up, but then they'll come right back to you. Is that about right, Pam?
Yeah, no, it's just people that know horses. You just have to be aware that they are sensitive. Yeah. They're flight, so be careful always. Well, but they're also sweethearts.
Well, when Michael was doing it with us before we got Pam on board, and Michael can attest to this, we had some horses that were pretty radical, and we'd put lip chains on them, and we'd have them tied down tight. Pam came on board. Pretty soon she's doing it without a halter. So
I don't put a halter on one of my horses right now. But when you speak of the bleeding, and a lot of people, we speak in racetrack lingo that people don't understand, but I mean, it is amazing, and it doesn't sound as amazing when you speak in those terms. It's almost like taking a child that's in a full-blown asthma attack and asking them to go perform at their best. And every animal that I treat is compromised to the point where they shouldn't even be an athlete, yet this product has brought them to where they're winning races at top levels. And that's, I mean, having no lungs is like having no legs, and it's amazing. And I mean, I don't know if people understand how amazing that is, to be compromised to that extent and still have a record like your product has.
Yeah, we've been very happy, and here again, what we're doing is we're just putting that body back into homeostasis. We're getting it back to where it's like rebooting a computer. When you have a computer that's going slow, what do? They completely wash the hard drive clean and reinstate a clean slate of things, and your computer goes back to working properly. And I think we're doing about the same thing with these horses. We're really rebooting that whole immune system to the point where it's become more efficient to take out the various stresses and strains of performance. And all our horses is a pasture animal. They're usually out in the pasture grazing all day and all night, and we put them in a stall, 12 by 12 stall, 23 out of 24 hours. And that stress alone is really detrimental to the horse's immune system, but I don't think people realize how detrimental it is. But I think that's where we are helping to breach that gap. So,
well, why don't you tell them a little bit about what our normal treatment is for bleeding and how you dehydrate them with Lasix and how detrimental that actually is and how much better to actually protect their immune system.
Thank you, Pam. That's great. That's a great aspect. Yeah, right now we use our basic treatment for bleeders is Lasix, which is a diuretic. It's used commonly in the human field for lowering blood pressure. So we're lowering the blood pressure of the animal, especially that pulmonary blood pressure. And we're even doing more than that. And because of the effect that it has on the heart, it makes the heart more effective. The stroke volume of the heart becomes more efficient. They're pumping more blood through the lungs and oxygenating more blood, so you get a higher oxygen tension in the animal, and the blood pressure is probably reduced because of that, along with the dehydration. But the downside effects are the horse loses protein and they lose calcium and potassium in that process from the diuretic. What we're doing with the BioPro, we're restoring their immune system. They will restore the protein and the other electrolytes from the water and feed, and we give them amino acid preparations as well to help restore that body. And they come back. By the time they run again, their body's back. After about 3 days, they're back in normal shape. But the main thing is their lungs are clean. They're able to heal, and that's what part of this process is. We're healing those lungs.
Dan,
we treat. Yeah.
Real quick, while you're on that subject, we have a question for those in the audience that don't really understand. It sounds horrific when you say that these horses are bleeding for their lungs. Dad Ashore asked, is the bleeding described the same as a burst blood vessel? Is that what's happening, or is it something slightly different?
Well, what happens is the small capillaries in the lungs break down due to the extra blood pressure, and you get a seeping. There's 5 categories of bleeding from 1 to 5. Most horses will perform even if they bleed in 1, which is just a small trace in the trachea. When we scope these horses with an endoscope, we grade the bleeding from 1 to 5. A steady stream is a 5, and it's not like you have a bleeding wound. It's an ooze, and it's after about an hour or so, everything is back to normal. But during that high intense exercise, you get that oozing in the lungs, and it's not a condition where well, let's put it this way: it'd be very rare if they bled to death. They all as the blood pressure goes down, the bleeding stops. So that's basically where we're at.
Great, thanks.
I have a question.
Sure.
This is Wayne. We have a couple other questions here, but I want to go back to Roxanne has a question, actually a comment. She says people wouldn't do that to their dogs. I'm not sure what you mean by wouldn't do that. Maybe you could re-clarify that. As Mike mentioned earlier, I'm a dog fancier and have been for 40 years. And what a dog fancier means is someone that is using their dogs for some kind of competitive purpose, as well as loving them, obviously. Any given time, we've had from as little, and actually the smallest number of dogs we've had in 40 years is maybe 3, and most times we're at 7 to 10, and there have been times when we have 20 to 30, and we had in a kennel situation. And we work with competitive dogs, and so competing means running in the field. So a lot like a horse would run in a competitive situation. These dogs are working to their max. Also in agility, where it's a lot like a sprint, where they're doing it very quickly over a minute period of time. And even though bleeding in the lungs in dogs is not talked about, it's happening just like it is in horses. And it's happening in people. I'm also an athlete. I run endurance races, 100-mile plus races in the mountains. And I've had 2 different times where after a race, I've had treatment for bleeding in my lungs in the same sort of way.
She did clarify, Wayne, her question. She said that we wouldn't lock up our dogs for only an hour, only have them out an hour a day. So that's what she was talking about.
Yeah, that's a little different. But
okay.
the
well,
problem...
actually, let me clarify. You know what? She's not right. Those competitive dogs, a lot of them that I was talking about, and she may not want to hear this, but the professionals that run them on dog circuits around the world, they sometimes don't, they're in kennels. Sometimes they're in kennels that are as small as their dog boxes for all day long, every day, for a lot of the days of the year, and then they're out running for an hour or something like that. It's a very similar sort of situation as you have with horses, in the dogs that are very competitive. So.
Thanks, Wayne. My whole approach to this is a ounce of prevention is worth a pound of cure, and because we're stimulating this immune system throughout the body, and dogs, cats, whatever, dogs and horses are very amenable to virus diseases, and that's one of the big bugaboos. And especially if you're traveling from place to place, you're going to have a problem with viruses and or bacteria as they go into virgin areas that they're not used to. So that's one, and we'll get into that a little later. But that's one reason we do it routinely, is because these horses do travel as well, and we're able to help fortify them against those disease processes. And when you have a EHV, it's a herpes virus breakout on the racetrack with influenza. It's a detrimental thing, because they start quarantining barns, and you can't race until that's over with. There's a 10-day, 2-week period, and there's a lot of potential loss there. So we're using this as not only a treatment, but also as a prevention. So I think that right now I want to get to our main reason for having Pam on, as well as having her explain what she does. Pam, why don't you just kind of explain what you do on a daily basis, and then we'll get into that orphan foal Red Moon baby that you had that experience with, and we can explore that a little bit.
Well, what I do is I work for you. But the reason I work for you is because I've known you for, more years than I'd like to admit. I would say probably 30 years, when I was a newbie at the racetrack, and you were always had a well-known practice. And what I liked most about you is you were always looking outside the circle, and the circle being meds and masking symptoms, and always looking for a way to make things healthier. And you and I talked about the electromagnetics, and before that was the thing, and you were always pretty much right there, like I said, open-minded, where a lot of vets and a lot of doctors want to just prescribe detrimental medications. They call things medicine when they're really poison. And what I loved about what you guys are doing, is why I jumped on board, is my interest in also the same thing, just being healthy. And I'm not here to tell anybody they shouldn't put their dog in a crate or shouldn't put their horse in a stall. What I'm saying is that you offer a product that no matter what you want to do with your animals, because I can't save the world, that you're going to have a healthy animal. And I love being on board, and I love watching these horses change day by day, and actually just hearing that my horses won, and knowing that they started compromised, and we didn't mask symptoms to bring them up to a level. We didn't slip them a masking drug that made them run faster. You made them healthier and happier. They start eating better. They're happy to do their job. They love life. Horses love to go out there and run unless they're compromised. So I love what I do for you, and it's been a lot of fun just watching the horses change. I know you talked about, you should go sell product and this and that. I'm like, wow, I really love watching the horses, touching the horses, having them know me, having them like what I do for them. And I enjoy it a lot. And Also, I mean, as far as that, I know, did you want to get into the foal right now? That was really early on in my, in this venture with you guys, was the foal situation.
Pam, before you get to that, because I think we probably got users that don't have any idea what happens with a horse on a daily basis when they're trained at the track. That's your experience. And so maybe talk a little about that, and then also how you get involved in that because of your love for doing it. And then we'll move to the foal, because that'll help people understand.
Mm-hmm. Like what I've done at the racetrack?
What does a day look like when you're there? When you're there and you're going to be working with the horses, is it in the stall and you're doing the treatment before they work for the day and so on?
Usually it's after they work. It's a real pleasant, it's afternoon. I pop through there. I actually don't even, I used to have to put a halter on and actually handle the horse. The horses come running to me now. They get hugged, they get pats. I don't even have to, I literally can't miss any horse that's on the list because they will not let me pass their stall. And a couple times, we've had horses that are in racing, and I don't even want them to see me because they're getting prepped. But and I distract them when they see me. But anyway, the horses go through a lot at the track, and they're athletes, and they get up early and they go to work, and but they, for the most part, they love what they do. They really enjoy what they do. Like I said, as long as their bodies are healthy and they're not being pushed, you're actually pulling those horses to slow down, not kicking them to make them go out there. They're eager to train. But there's a lot that has to happen. A lot of pieces of the puzzle have to fit in order to have a productive horse that actually will make you an income. Well, income, will actually pay for itself. Yeah.
Wayne, back to your question about what they do in the morning. The horse will usually come out. They go to the racetrack. They'll either jog a mile, gallop a mile, come back, get washed, walked 30, 40 minutes, go back in the stall, and that's their day's activity. Now, once most horses are on a 7-day work schedule, so every 7 days they'll work. They'll go out and work. They start working quarter miles and then work their way up to 3/4 mile or more, depending on what they're going to run to. And they come back, and some of these horses will even bleed working. And we've had especially young horses, 2-year-olds that have we call it lymphoid hyperplasia of the pharynx. They get these little blisters in their pharynx, which is an allergic type reaction, much like an asthma attack, because they're in these stalls. They're not, the air is fresh air is inhibited, and they get these little blisters which cause mucus, and here again it kind of plugs up the airway, and as Pam said, without any lungs, you don't have much of a racehorse. So what we're doing, those kind of horses we treat very effectively as well. We reduce that inflammatory response, that sensitivity they're receiving from various allergens, and reducing the mucus so they can breathe more clearly, and thereby they perform better. Now, horses that are on, and you got to realize that horses that, especially claiming horses, usually have problems, arthritic problems, just like we all do when we get a little older. But they have problems from traumatic stress on the track, that and even some of these upper respiratory hyperplasias. Veterinarians who use a lot of prednisone or steroids on them to quell the symptoms. And the first course of corticosteroid therapy will compromise the immune system. So some of these horses, if they're bad bleeders or on extended steroids, their hair will turn backwards. They'll be dull hair coats, and they just look unthrifty. And I think Pam can attest to this. After they've been on the BioPro for a couple of weeks, they start looking like slick seals. The hair gets slick. They get those big dapples, which is a sign of health, and they're just happier, and they're eating better, and they just turn them around. So that's basically what she's talking about, seeing them change. And I think you've seen that in most cases, haven't you, Pam, with your, as you treat these horses, the longer you treat them, the better they start looking.
Yes, I haven't. I actually started a horse at Santa Anita. I'm not going to say who, but, and then you treated her at Del Mar. So I had a couple treatments with her. I watched her get, put some weight on, look a little bit better. She went to Del Mar with you. You treated her for about a month, and then I went down there. You had her on my list, and I almost did not recognize her. I mean, I recognized her, but I mean, it was a huge change in a matter of a month, about a half, almost 2 months.
Yeah, they get what we call a mask around their eyes, which is, to me, it's a very instructive symptom of health. The hair around the eyes gets a darkened mask, and the skin color becomes dark, and their whole attitude looks better. They do eat better. They start putting weight on. So
let's Dad, in the interest of time, we're 20 till the hour right now.
Yeah,
we
I
want to
think
try and finish up about 9 o'clock if we can. So let's have Pam go into the full thing. Pam, somebody mentioned Super Tech, so I know he knows what he's talking about. Do you have a pair of these earbuds from like your phone that you can plug into your computer?
No.
Okay, no problem then. We'll keep moving forward with it. He suggested that maybe that was the reason we're getting some feedback there.
Oh, it's me. See, there you go, giving you feedback again.
I know. we love your feedback, but if you could go.
I'll keep muting when she's not.
Tell us about Red Moon Baby and the experience you had with her, Pam.
Okay, I'll tell you about Red Moon Bay. A very close, one of my BFFs is also an extraordinary horse person. She called me, and she's actually in the medical field, in the human field, but she called me. She was on mare watch, and her mare was going to foal. She called me late. She noticed that there were some problems with her foal, and the excitement quickly changes when you see there's a problem. So what happened was, the night of the blood moon, we were up chatting, and she noticed the mare was acting strangely. She foaled. I want to say, I think she said she foaled this horse actually standing up, running, like moving, and the foal hit the ground. She did say hello to her briefly, and the mare then went into a blind run and died. So
And that's a picture. That's a picture of her there.
Yes.
And that's the mare whose head is looking down?
Yes. So briefly, not long after that shot, the mare and actually the foal went to try to get up. And when the foal tried to get up, the mare just mowed her right over. So she was already a dead horse moving. She just was, it was just reflex at that point. But
is there, do you have some explanation for that? Is that at all? I mean, it sounds interesting.
Well, it does. It can happen. She maybe bled out. There was maybe a tear. I'm not sure.
She probably tore aorta.
It looked like there was way too much blood in the placenta when it wasn't normal. It wasn't a normal.
Or the uterine artery probably ruptured.
And there's nothing really. I mean, there's no medical way you could have saved that mare. It was just a very, very, very sad and unfortunate situation. And what was really sad was the fact that the foal was extremely compromised, and actually one lung wasn't even fully expanded, and it was bleeding out its nostrils and mouth. So she called me, and we were FaceTiming, and she asked me, "What about this new product that you're dealing with right now, this BioPro?" And I said, that's a long drive, and I asked Dr. Warren if it'd be okay if I would treat this horse. I didn't think it was going to live very long, but sometimes she's one of my very closest friends, and I just wanted to be there with her, console her, let her feel like we were doing all we could do. And my chances, or my thoughts at that point, were the foal had zero chance of survival with no colostrum, and just the whole traumatic entry to this world was way more than most horses would live through. So, but I went anyway because she's my friend, and I grabbed that BioPro, and I'm thinking, this is like such a waste of my time, but I love my friend, and I wanted to be there for her. So I did it anyway.
And there's a picture of you with the
So
full
she
mask.
actually, what she had done was she picked up the foal from the field, threw it in the back of her truck, and brought it to her house. And I went to her house. I treated the foal like 7 hours after or something like that, right about then. We started treating the foal with the BioPro. And just to make make a long story short, the foal progressed really, really well. I mean, even though the first 4 days of its life, it was bleeding out its nose and mouth still. I think maybe the BioPro, because of its elements, helps that bacteria level stay down, is thriving today.
How old was the foal in that picture we were just looking at? You saw that, and then it looks like it must be standing here. So.
Yeah, she was a couple weeks there. She was a couple weeks old there. Maybe
when you were doing the nebulizing, that was within what, 7 hours, right?
7 hours we started. Yeah. And to be honest, like
Mike, go back to the picture of when she was born, because I think, again, there's non-horse people probably on here watching, and as people look, that horse was just born and a lot smaller, obviously, and so she had to deal with that 7 hours later. So the horse was the size that you saw in that first picture at that time, everybody, not this size. I think that's probably, this horse is obviously larger now, and up there we go. And the mom's head is right next to it, so you can see the size of that horse.
She was actually a pretty big foal, though. It's amazing how, I mean, in the wild, they don't have a lot of time to grow up like us. They get up within the first few hours, and they better be running, or they're going to be a meal. And she was pretty. I mean, that first when she was laying down in the stall, that might have been a week later when she was standing up, or maybe a few days later. But yeah, that was right. That was right about the first. That was the first morning when I was laying. The foal did not get up at that point.
Okay.
At that point, the foal was down, and didn't get up for. I'm not exactly sure because I wasn't the whole time. It wasn't there the whole time, but she was up just minimal points in the day and then laid back down. To be honest.
So are you administering the BioPro right now in that picture, the one we're seeing through? Is that the nebulizer?
Yeah, I just picked up the horse's foal and set his head and just set it in the nebulizer and wrapped a towel around it, because at that time we didn't have full nebulizers as we do now. So I just threw the towel over her and just had her breathing that. I figured, at this point I was very grim. I was just, like I said, I was just doing it with my friend to just know that when the foal died, we tried everything that we could do, and it was pretty amazing. It was a pretty amazing result. She just snapped out. That picture of her drinking her milk in the corner. She was only like a week and a half old at that point, so she just bounced right up. I mean, I know people don't.
How old is she now?
I want to say she's about a week and a half there, or some. She wasn't very old. Within the week.
Now.
Well, right now she to be broke. She's 2 years old now.
Okay. Wow.
Yeah, she's 2 years old.
Here we go. She's running here in this picture.
Yeah, she's running.
And how long did you keep administering the BioPro?
I think she still does here and there.
Bioequalizer. I got to change it. It's bioequalizer.
In actuality, the gal is a nurse and a horse person and a nurse, and she also, from this point, was so amazed also that she actually works for Dr. Warren administering the product also at San Luis Rey Downs for us, because it was something that you just don't normally see. I mean, anybody that's been around foals and the whole birthing process is it'd be hard to find someone to say that horse had more than a couple % chance of survival at that point.
Well, here she is. It looks like ready to,
That's a recent picture.
Ready to be broke.
Yep.
Very cool. By the way, Kim, thank you for your kind words about thanks. It was a pretty amazing recovery. And that's true. It was. But we could give you, I'm going to rush just a little bit here. And Mike, I'm going to have to jump off right at the hour. But This is one story of many. And we are really today publicly announcing that this product, which Dr. Warren has been using at the tracks and circumstances like this, is now going to be broadly available to the public. And we've even changed the name, and Mike, you might comment a little bit more on that, and Dr. Warren can also, but to now BioEqualizer. And this is going to be available for anybody so that they can be having these kinds of amazing recoveries, which isn't just in falls. It's all different times. So, Pam, what kind of, what did you see here that surprised you? And well, it surprised you that the course lived, obviously, you said.
Well, it really did surprise me because, in fact, I'm really sorry that I didn't use this foal as a case study, because I'm going to reiterate, my thought was this horse had a 0% chance of survival. This was just, buddy time with my girlfriend through really rough times. And I, in fact, wish I would have documented every moment so we could have used it as a case study. But the reason it's my story is because I'm also was surprised.
I'm going to jump off here a little bit too, because I was curious whether anybody else wants to jump into a seat. We'll open one up. And Kim Wendy, I'd love to hear from you. Again, you've got it looks like a lot of experience with horses. Love to hear what your thoughts are about this. You've made a couple comments over here, but I'll jump off, and the rest of you can continue. I'll still be online here, but I'm going to open up a seat here, Mike.
Thanks, Wayne.
And just real quickly, what Wayne was talking about. If you go to our website now that you see it under my name, BioPro Plus is the human product, the animal product, and it's a different formula, little different formulation for the animals. It's the same protein that is produced in all mammals. It's a bioavailable protein that our bodies make, and it's a bioidentical protein. And that's why we're going to have, the animal name is going to be called BioEqualizer. You go on our website, you can buy the product for yourself called BioPro Plus. That's just it in a nutshell. We'll get into some more. Was it Kim? If she wanted to take a seat, go ahead. But I know you wanted to get into a couple of other case studies. Dad, I don't know if you want to go in and talk about the epiglottis. We're running a little short on time. Or if you wanted to jump right to the dog. Right to the dog.
Yeah, I'm gonna go right quick, Michael. We've got basically there's we started out with on this project with treating just bleeders and horses with mucus, and as we've gone along and Pam has made the observations she's had and myself, we're finding, of course, these horses regenerate quicker as after they run, and they also get healthier and eat better just from a preventative standpoint. And I've got three cases that I just want to mention quickly. We had a real severe bleeder that Pam was working on, and you and I both worked on, called Private Zone. He was bleeding fives and was not running well at all. After after about a year, we got him to the point where he's not bleeding at all. He won a Breeders' Cup race, and he's still making money as I think he's a 7-year-old now. Then we had a horse called Golden Sense, who was in the Triple Crown as a 3-year-old. He came back from the Preakness, dead tired. I mean, his nose was touching the ground. He was dead tired off his feed. We started him on the BioEqualizer. It was called BioPro then, but it's BioEqualizer. I got to get my nomenclature right. And within three weeks, he's back into the bit and training forwardly. And we kept training him. He went on to win. He's the only horse that's won 2 Breeders' Cup dirt mile races in successive years. He's now in the stud and earned well over $1 million, couple $1 million. And then thirdly, which we're treating now, Pam treats him 3 days a week now. We got the 2-year-old horse of the year, and he won the Breeders' Cup Juvenile this last year, a horse called Nyquist. He is probably one of the early favorites for the Kentucky Derby. So This horse was a completely normal horse and had no problems to speak of that were very serious, but the trainer wanted to put him on it just as a preventative. And I think you've seen, Pam, you've seen this horse change as well, just from the BioPro, from a healthy horse to a healthier horse. Yep. Is that right? What kind of
the amazing thing is that the stresses that we put these horses through to keep their they have to be at optimum levels. They have to not have any downtime in order to just keep on that trail. And what I've seen is that none of our horses, although most of them started off compromised, have had downtime. Like they're off for a week because of, they have a cough or they have, a snotty nose or whatever would put them on the shelf for a few days. I haven't seen that. So the fact that we can just continue moving forward, I mean, not that you're not going to have other hurdles, but the fact that you don't have that one, I mean, their actual health is they're in good health. It makes our whole job easier, or I'd say but as a trainer, it makes your job a heck of a lot easier if you don't have to dodge around illnesses. Right.
And then early on, we had two cases that were protracted. We had a case of a subepiglottis ulcer that a surgeon was refractive to surgery. He didn't feel he could do any surgery, so he said, see what you can do with the BioPro. We used the BioPro and the silver solution on this filly. And in 16 days, we had that ulcer. It was about the size of a quarter under the epiglottis. We had that ulcer completely healed and back in training, which is really unbelievable. That filly probably, under normal conditions, would have taken, there's some pictures, it's kind of hard to see the before and after, but this filly would have probably been out of training for 6 months without the treatment that we gave to it, just to let it heal. And it not only healed, but it healed with a minimum of scar tissue, which is very important. And even today, horses that are going in for throat surgery, we recommend, and we've treated prior to the surgery and after the surgery, and they heal so much better. They have a lot less chance of getting chondritis, which is a problem with the vocal folds, and they just heal a lot better and quicker. Then we had a horse with a foot abscess. This horse had a foot abscess or canker. They'd been working on this horse to try and heal this foot abscess for over a year, using antibiotics, stem cells, and everything else. We used our BioPro and bioequalizer, and the nomenclature is still getting me, and our immune gel right in the wound on a daily basis. And in 3 months, we had that foot healed up, and that horse got back in training and raced and won again. So then finally, I want to show some, we also use it in abscesses. We put the silver solution and the BioPro right into the abscess. After you drain the abscess, flush it out, and then put this in, pack it in there, and it'll increase the healing process of abscesses and cut your healing time down by half. I mean, they'll heal 50, 60%, even maybe a little greater, faster. I just had a case 2 or 3 days ago where a horse grabbed another horse veered over on a horse while they were working. He grabbed his tendon behind and cut the skin in a usual triangular pattern. We put the material into the wound and sutured it up, and that horse is really healing very well. Finally, and the one that's very interesting, probably to Wayne, is we had a dog. A trainer that I work for has a dog that she bathed in a chemical solution, and it got an intense allergic reaction, and some of this material got in the eye, and you can see the eye. There's a dot in the middle of that eye, which is a ulcer. It drilled a hole right through this dog's cornea. She took it to the vet, the small animal veterinarian. It was the eye was starting to melt, and he said the only thing we can do is enucleate that eye, take that eye out. And about a week later, she don't go so fast yet, Michael. A week later, she was going to take him down to the vet to nucleate that eye, and I said, "Where are you going with the dog?" And she showed me the dog. And I said, "Well, let's try this on her." So we gave her some the bioequalizer powder and some of the silver gel. I told her, and silver solution. Flush that eye out with a silver solution 2 or 3 times a day, and put the thymic protein in that eye once a day. I think we did it for the first 3 or 4 days, twice a day. And this was, I think, on June 3rd. The next picture, Michael. 10 days later, the eye looked like this, and I was really worried. It looked to me like it was going to start to melt, but this was just epithelialization taking place. The ulcer's healing. It doesn't look very good, and I thought we might be losing this eye. We kept the treatment going, and the next slide, please. This is the eye about 2 weeks later. You can see that there's a smooth epithelialization, keratinization taking place. The defect is completely healed. The cornea is smooth. The eye you still can't see out of this eye, but we continue treatment. We back down to the thymic protein every couple days, once a day, every couple days. Still flushing the eye with a silver solution and using the gel once a day. And let's see the next one, Michael. That's the same. That's about a week later, which just shows a little bit more of the healing process. You can see on the nose. We also used on the nose. There was a denuded area around the nose that was raw when we started. It's now healing, and the skin is the hair is starting to come back. Then finally, I think your last slide, Mike.
Oh wow!
This is the eye about 10 days later, and that, as you can see, that eye is completely healed. There's still a little bit of a blue in the middle of it, but the dog can see out of it. And today there's just a very, very faint blue scar left, and the dog is happy, and he can see out of that eye, and we saved that eye. So that's pretty amazing. And I think that it's because the BioPro, this thymic protein, set up a inflammatory response right at the site, brought the healing processes in. Got rid of all the infection. The infection's what kills, keeps us from these things healing properly. Made that a sterile situation where the eye was able to heal without the extra problem of having any infection. And I think that's the secret to it.
Mike, one thing real quick, I'm gonna have to jump off, but go back to the very first picture there and then to this one, just to show a few folks again that have just come on what's happening. Okay. I don't think people realize how amazing this is.
Yeah, this is really amazing.
Most people, most veterinarians, and I've seen this many times, would have given up on that eye when it looked the way Mike's going to show us back here, and just done the approach that you said. They're going to remove it. And,
yep.
And even at this point, it's showing a little improvement. It's showing a lot of improvement here over previously. Look at the muzzle too, right below the eye. Yeah. I'm pointing actually, I guess if people can see it, and then out over towards the nose, and look at the color also. So look at the color in this dog's face. That's the same thing. I understand dog eyes like you do around horses. That's not right around that dog's eye.
No, not at all.
And not just in the eye. And then keep going through, Mike, and we'll get to the last picture, and you're going to see, look how much more healthy everything around the eye looks in the muzzle. There we go. Look at that. I mean, there's just a little bit of a tearing, which is not unusual, but look how healthy everything around that eye looks.
You have one more picture, don't you, Michael?
No, that was all. We went through all 5 of them. There was only 5 that I had.
I thought we had one more, but but today also in the back, I didn't have a picture in the back. The back of this dog's on the dog's back, the skin was gone. An area about 4 inches by 3 inches wide, raw red material, and we did the same thing there. We put the the product and the silver gel in that area, and it took within days it took the redness out of that raw area, and that's all healed back now. So
well, this is amazing stuff, and I'm going to jump off because I've got another call that I've got to go to. Again, we're going to replay this, so we will be actually modifying it, editing it a little bit. There will be a replay of this which everybody can watch. Please encourage you to do that. We'll be talking about this whole product line in a lot more detail. Pam, it was great to get to know you a little bit. I want to end with one little quick story just to show people how large the horse competition market is. So we have a stock show going on here in Denver right now. It's called the National Western Stock Show, and that's where people come in from all over the country with their animals of all different kinds. I've heard that it's the second or the largest in the country. Houston, go back and forth. Well, on Friday night, I went to a bull riders only event, and that was just what was going on. Well, at a break, they had a penning competition, team penning, and it was actually the championships of the team penning. And in team penning, there are 3 riders that are taking a group of calves that are in the ring, and they're separating out 3 that have certain numbers on their back, and then they're getting them into a pen. Really cool to watch. That's not my point. There were 1,000 teams that were entered in that competition. Yeah. 1,000 teams that came to Denver, Colorado. 3 people on a team, so that's 3,000 people, probably 3,000 horses, because they all have more than one horse. And that competition lasted for 10 days, and we saw the finals on that evening. Every one of those people has interests related to their horses that are similar to what we've been talking about here, and have had medical problems of every different kind that you can imagine. They will spend thousands and thousands and thousands of dollars to make sure those horses are healthy and are their well-being is what it should be, and that they love them. They love them like they love any human being in their lives, and maybe more so in many cases. So that's just an example of an event that most of you have never even heard of. You've all heard about the Triple Crown.
Oh yeah,
you've all
for sure.
heard about horse racing at these big tracks, but here's just one competition. But again, we saw the winner that night, but there were 1,000 competitors that started 10 days earlier.
One thing, Wayne, one thing I wanted to reiterate, and Pam touched on it, and is an important part about this. These animals you're talking about go to these events, they travel long distances. And the worst thing can happen is they travel to that show, and when they get off the truck or trailer, however they get there, they pop a temperature from shipping across country. I think that if you keep these horses, put them on a routine basis with the BioPro, the BioEqualizer, and then ship, you're going to have a lot less chance of having that animal come up sick at the other end of the line. And that's one of the main things we want to focus on is prevention. As I said before, we're trying to prevent those things from happening so your animal can perform at its highest level all of the time. Yeah. I think Pam has bore that out, haven't you, Pam, from your experience?
And people don't understand that some of those bacteria that take your horse out, like strangles, could live dormant on a pipe for years and years and years, and all you have to do is tie your horse to that pipe, and it's compromised. And this is some way to. I mean, who wants to take a sickly kid and drag them around the grocery store and throw them in a basket? But you'll take your healthy kid and actually makes them more healthy to actually introduce them to things that their body can fight. And this just gives your body, the horse's body, a chance to, hey, I'm not worried about, it just drank out of a community trough. Oh my goodness. So I don't worry about that. My horses are healthy. I don't have a compromised animal moving, but you do have to be careful. I mean, you move your horse and you trust that these stalls are clean, and they're not. They're not. You have to be careful.
Bye, Wayne.
Bye, Wayne.
Bye, Wayne. Well, that was good. Well, Michael, we're almost we're past the 9 o'clock hour, so
I know we're running out of time.
You have anybody out there with questions before we get off?
Well, just real quick, Roseanne asked, but I think she's actually gone. Just if we had any thoughts on using horses for disabled. I'm assuming disabled people or help with people that have disabilities, but. No, personally,
Pam can answer that question.
Yeah.
Horses can heal the world. Horses are, they'll lead you into war, or they will carry around your handicapped child. They are everything, and they are amazing, and they're all three of our lives. So
yeah, they are.
Well, then not only they'll heal us, and as we heal them, they'll heal us.
Yeah,
that's for sure.
Yeah.
Did you have any parting shots, Pam, you wanted to leave with today?
No, I'm just happy to be here, and I'm really excited to start this venture with you guys. And like I said, I'm just super happy with the natural, holistic way to better our lives my animals are my family also. So I'm really happy to be a part of this.
That's really what's exciting about this product, and why we feel so passionate about it is because not only does it help with our animals, it helps with us. And our pets are our family, but this is a bioidentical protein that all mammals produce. So it benefits human and animals alike. And our pets are just as important as our family. And that's why we're launching the pet site coming soon in the next couple of weeks, with the emphasis on horses to begin with. And then we'll have a whole site dedicated to dogs and cats, and even rabbits or other animals that you may have, pets that you may have, that can benefit from this thymic protein that we've been able to isolate and develop into the protein powder that it is today, to which we can take and it assimilates into our body, and we can all become healthier from it, whether we're fighting chronic disease or just want to not go through the cold and flu season like we're in right now unaffected. We have that ability with this product. So that's what we're all about. That's what Alternative Health Concepts is all about. Getting ourselves healthy alternatively to the prescription medicines and that are out there for ourselves and our dogs and our cats, and most importantly in our family, horses. So,
well, Michael, one thing I want to reiterate, because sometimes these things come across as this is a miracle product and it's going to do everything for everything. It's not that. It is a very important part of the matrix that our health encompasses along the bleeding EAPH that we were talking about earlier. We do still have some failures, and so we haven't got all the answers yet, but we have one important piece of the puzzle, I think, in this immune modulation, because they're finding out in the humans, and we're not far behind, that the immune system is really the seat of all healing, and without a strong immune system, we just don't heal. And so from that aspect, we're just one piece of the puzzle.
Yep.
I think a very important piece, and as we learn to capitalize on it in the various instances we come across and get more refined, I think we're just scratching the surface with this product and how it can help us. There's things that down 2 or 3 years from now, we'll say, I wonder why we didn't think of that earlier. Just like this foal that Pam talked about this morning. Here's a foal that looked like it had a grave prognosis, about ready to check out of this world. And for some reason, we got the immune system operating, which is a big problem with foals all around. The first 5 or 6 months of their life, their cellular system is developing. I think what we're doing is we're replacing that protein that they are unable to replace to help their body get more immune strength, and thereby I think we can overcome a lot of foal diseases like rotococcus and these other diseases just by strengthening the immune system along with the antibiotics they use. So yeah, it's a very exciting field to be in, and I think we're just scratching the surface. But thanks, Pam, for all your work. You're a great asset to the team, and we hope that we can yet find new ways to make our horses and our pets happier and healthier.
Yeah, and one last comment: the fact that you can actually bring your horse to a healthy spot without dumping grains and vitamins. Sometimes we put our children on these horses and we're worried about feeding them too well for our children. And this is a way to actually keep your animals healthy without having them jumping out of their skin. And, you know, these horses that my 5-year-old daughter is riding, you know, I might think they need a little boost to their immune system, a little red cell, but you think, oh, maybe I shouldn't do that. And this is a way to actually keep your horse healthy without that maybe becoming a problem.
Well, that you just hit on another subject. When these horses are in tough competition, they're on very high energy feeds, high grain feeds, and that again has a tendency to drop their immune system. I mean, it influences the body in different ways, and
It actually
it's
can
unnatural.
Overstimulate the immune system, can it?
Well, you can't. I don't think we do that. But they're with the high energy feeds. They're on nutritional overload, and that's why we see some horses tie up and other metabolic diseases that we're having. So if you can increase their health, and as you say, back off a little on the high energy feeds and get the same results, I think you're probably money ahead.
Mm-hmm.
Yep. Well, with that, we'd like to thank everybody that's been here today. We've got to get going, and some of us have got to get back to work today. Really appreciate, Pam, you taking the time out to spend here with us. Dad, thanks a lot for everything. Again, if you want to know more information, go to the website. It's right under my name, alternativehealthconcepts.com, and you can find out more about what we do. But what we do is simple. We try to put out information and products that will help you and your animals heal themselves naturally. So with that, let's sign off.